Hi, and welcome to the Fancy Comma YouTube. Today, I'm joined by Anna Culbertson, Erin Melton Backus, and Abby Tai. Anna Culbertson is a former scientific program specialist from the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. She also serves on the board of a rare disease patient advocacy organization, Congenital Central Hypoventilation Syndrome Network. Anna, along with others, co-founded 27 UNIHTED in the wake of the large-scale NIH termination and reductions in force to bring together the NIH community, support one another, and fight for the future of health research. Erin Melton Backus is a former health communication specialist with CDC's Office on Smoking and Health. She co-founded Fired But Fighting / the National Public Health Coalition to help support current and former feds and to advocate for the future of public health and its role as a government service. Abby Tai is a founding member of Fired But Fighting / the National Public Health Coalition as well. She worked as a public health advisor in the Division of Overdose Prevention at the CDC. So it's great to have all of you on here. So I'm assuming you're all affected by the recent NIH reductions in force and CDC reductions in force. So how did you all get started, or what made you start doing the work that you're doing? So tell us about how these organizations came to be and what your stories are.
So Erin and I were both fired in February, and I think Anna was as well. So we were all probationary folks, so had been there less than 2 years. And so we all kind of were hit in this first round of firings. And Erin is like a little different than us because she was also RIFed. So she was fired twice, whereas Anna and I were fired once and then really truly separated in May. And so these organizations kind of came up like really from like a grassroots need for information. So Fired But Fighting started as a newsletter for probationary folks who had been fired as a way to let them know what they needed to do for health insurance, what HR was offering for them, like how to kind of navigate this space while they were waiting to find out if they had been officially fired or not. And then from there, we developed a website to host the newsletter. And then it just so happened that our colleague Sarah finished this website and put this newsletter up. And then the next day, the large RIF at CDC happened where like thousands of people were fired. And so we had this space to already direct people to information that we knew had been approved and that was correct. At that point is when we started to have conversations with Anna a lot about her work that she was starting with NIH, which is a little different than what we're doing, but a lot of like intersections happening there.
I, similar to Abby and Erin, lost my position in February. And so I made this website myself called spoonfederal.com. It was just like a mutual aid resource website for federal employees, just like generally. From that, I got to meet like a bunch of other website creators kind of in a similar space and learning about different federal employee supports that kind of existed for people who lost their positions. And then, so in April, like when all the large scale kind of rifts happened at HHS, similar to CDC, kind of me and a number of other NIH folks who had like lost their positions, we just started organizing and saying, well, what are the needs here? We need like some job-based resources, right? We need some community support. Over time, we've grown into doing different but similar to Fired But Fighting advocacy, really talking about the importance of health research. Fired But Fighting, I know, is really focused on public health, which there's like a bunch of really great overlapping things, but also like slightly different at the same time as biomedical and just kind of general health research.
Yeah, and I think both these orgs, just like Anna and Abby said, came from a need for people to have resources to, file for unemployment and get information, but also just there was so much information coming out at all times that like it was helpful to have just somebody who was like, okay, this is what the court case today said and what it actually means, instead of a bunch of people going back and forth and saying, I think it means this, but I'm not sure, kind of spreading information that wasn't entirely accurate.
CDCers, we joke that the source of all misinformation about HR comes from our Proby chat because it just like would get wildly out of control.
Yeah.
That's super funny. I also think that some of the organizational stuff, at least for us too, is like, and even just speaking for myself, like I know it was hard for me to want to let go of a job, I felt I worked really hard to like get to, right? Like my career led to this place and I was really excited and I had a plan. And then the plan's kind of like in a completely different situation now. And so, I just think a lot of us really cared about the oath that we took and the service that we did for the public and wanted to be able to continue that in whatever way that we could. And so, if that's just helping our fellow colleagues who are in a similar situation, or just advocating for the importance of what our work was, or public health or health research in general, like I think we just wanted to continue to do that, even if it's outside of the agency directly.
So what are you all doing now? Are you all unemployed? Like, what's your day-to-day like?
Erin could go first because
Yeah, so I'm in a weird situation. I'm one of the very few HHS employees who's still on admin leave. So I've been on admin leave for 6 months since February 14th. But because my office is part of this like really specific lawsuit related to a couple of the CDC divisions, I'm still on admin leave, but I'm not working. So day to day is mostly just working on the fire but fighting and National Public Health Coalition stuff. Like, this is my unpaid job now. And yeah, we're just trying to get these organizations set up, and they could definitely turn into something that is like a full-time job at some point.
Yeah, I am fully unemployed, so I've been officially separated, living my unemployed life, looking for jobs, but also really focusing on this work because it feels really important in the moment. And like Erin said, we're hoping to really spin up an organization that can fill in some of the gaps that we're continuously seeing, at least in the public health advocacy space. A lot of volunteer work right now with some occasional job searching to appease my spouse who would really like me to find a job.
Yeah, I think I'm in a really similar. Abby and I both were officially separated on May 8th. I also would say that I work harder doing this than I think I would if I was working a full-time job. And I'll tell people, like, I'll do this for 10, 12, 14, sometimes 16 hours in a day. Like, I wake up and just, like, start, figuring out, okay, what emails do I have to send out? Do I have to make a flyer? Do I have to, like, have this meeting with new volunteers? Like, I feel like we're doing this all the time. And hopefully, as we get more formalized with the organizational effort, it can be more sustainable regardless of like whether we need to find full-time jobs or not, that we're like putting in the effort now. At least for me, like I'm putting in the effort now so that in a few months it's like, okay, this is how this works, it's smoother. But the grassroots element, I think, allows us to move really quickly. Both of our organizations have done so much in such a short amount of time.
So how many people are in both of your organizations together? Like, is it like a large group of people?
Yeah, so the CDC one is kind of cool. Because if you know anything about CDC, we're like really response driven. So like there's an outbreak, there's like some kind of public health emergency, and we have this response structure at CDC where like people roll in and out and like work really intensely for a couple weeks or like a week at a time, and then they roll out and someone else rolls in. And so we have almost inadvertently created a response kind of structure within our own organization because people are looking for jobs. They're really burned out from just like the constant trauma that's being rained down on us from this administration. And so we have kind of this response structure. And so at any one time, I think we probably have about 30 active volunteers. And I think that the rolling in and out piece allows us to have probably close to like 50 or 70 people who are in some way involved in firefighting in National Public Health Coalition, but may not be like actively volunteering at any one moment.
And we definitely see like an uptick whenever something major happens. So like, unfortunately, we saw an uptick after the August 8th attack on CDC. We saw another uptick when Secretary Kennedy fired all the members of ACIP.
That's the Vaccine Advisory Committee that approves all the vaccine schedules.
Yes.
So I have a question for you. I just heard that the US Census, I actually worked for the Census for 6 months from December to, June of 2025. While all this was happening, I got hired for working for them, and now I follow the Census news. I did my 6 months of service and my term expired, but I noticed that they did recently fire the head of the Bureau of Labor Statistics, and now the census workers fired workers are creating an independent advisory board. So I'm wondering, are you all at NIH and CDC interested in creating like an independent advisory board to provide input to different organizations, or is that something you're pursuing?
I think for us, like, yes, but we all kind of have really different roles. I mean, there are like advisory things that NIH does, but not in the same way that Census provides advice, and like not the same way that CDC provides advice. So I think it just kind of is like agency specific to like what we're able to, or what the gaps and like needs are going to be. NIH, we're seeing, I mean, on Friday, the Supreme Court ruled that the APHA versus NIH case was able to have a stay, which basically means that NIH, while they're awaiting the legality of the grant terminations, can terminate like a bunch of grants if they want to. And so we're trying to respond to that in like a storytelling way. It would take a long time to build up the funds to be able to pay for all of the grants that are being terminated or like potential to be terminated. You know, I think that's a really cool goal to have. But like for NIH, like our rapid response to that is like talking about it on social media, trying to get to stories, trying to include the extramural community in our efforts. But some of what we can do is limited based upon like time, resources, and energy, and like NIH's particular role in things. And I think Abby and Aaron would probably say something similar about CDC.
Yeah, and what we've looked at more on the CDC side of things is providing not like an advisory board on the agency themselves, but maybe more on like politicians and their support for public health. So one thing we've talked about is providing endorsements to candidates, or saying like this person is like a public health A, something like that, because of like the policies they support. Because one thing we want to do with Fire But Fighting / National Public Health Coalition is prevent something like this from happening again, and addressing the underlying issues that led to the decimation of the health and human services workforce.
The unique thing about CDC, while we are generally like a guidance agency where we provide recommendations, and that's kind of what these advisory committees do that you've seen removed from the CDC, those are really medically like driven. So oftentimes they're for physicians. And so we've really seen physicians, professional groups step up to fill those gaps that now exist because CDC has kind of been kneecapped in a lot of ways. So like the American Academy of Pediatrics is putting out, guidance. There are some new organizations that are really focused on like vaccines. And so they're trying to provide guidance for physicians on that. And so I think in terms of like filling gaps, that's not our role. Our role is like really broad in like the public health education and advocacy space.
So if you were to make a scorecard of people that we should vote for based on science and public health, which why didn't we have this in like pandemic, who would go on there? Do you have anyone, have you made a scorecard, or do you have any ideas of people that we should be supporting that support public health and sound science?
We don't have a scorecard yet. It's a dream. We would love to do it. But in like typical scientist fashion, we want to make sure we have a really sound evaluation system that is fair. So we're not there yet. I mean, we could probably speculate on people in Congress just from our conversations on who supports public health. But like, I think the important message here is all of our policymakers should be supporting public health, because regardless of how their constituents vote, public health programs are for every single person in this country. We should all be supporting prevention. And if politicians and policymakers aren't going to support prevention, this like report card is like how we can help voters know that like they're voting against like their own interests in a lot of ways.
Yeah. So then can I ask you, what about the votes that have already happened? So do you remember Senator Cassidy of Louisiana? He's a doctor. He said he would work with RFK Jr. and actually voted yes for RFK Jr. In what was a very, very close vote, and said that, oh, I'm going to work with him to make sure that he doesn't do anything to the vaccine schedule. And now RFK Jr. has done a lot with the vaccine schedule, and things that are affecting me that I thought wouldn't affect me. Like now I can't get the COVID vaccine. I was planning to get the COVID vaccine this fall because I don't like being sick. And I always get my flu vaccine, and I've been getting my flu and COVID. So now I don't think I can anymore. And some of it was the fear that Donald Trump would primary Senator Cassidy. And I think he acted out of fear. Have you looked at those votes? Like, are you planning to have your own sort of political activities against these candidates? Like, can you please do that? Because I'm very angry at them for this vote.
Yeah, I mean, we've tried to meet with Senator Cassidy too, but haven't had any luck. So, yeah, we would also love to know what he was thinking there and what he's thinking now. And I think he's being primaried anyways. Last I saw is that somebody is primarying him anyways.
Well, if I lived in Louisiana
Yeah.
and I cared about even my own health, I would not vote for him. How did your two groups meet? The CDC group, Fired But Fighting, and 27 UNIHTED. How do you say that anyway?
27 United.
27 United. Okay, so
Yeah.
27 United and Fired But Fighting. How did you all meet, and what have you been doing working collaboratively in our current times?
I saw another one of their co-founders and was like, hey, we should talk. Like, I have seen your website and I'm like very interested in what you're doing. And then we met, and then I feel like we just kind of stayed in contact after the first time that we met and just kind of kept each other updated. They've been super helpful. So because we didn't really start until the RIFs happened on April 1st versus they'd kind of had some infrastructure ahead of that, we're almost chronologically, when you look at the development of our organizations, like a month and a half behind Fired But Fighting, which is very cool because we've gotten to learn so much from what they're doing and just like seriously been very helpful to us in so many ways. And it's just been really cool. But so we work together. Like I did a legal thing with their group yesterday for a community of people geared towards State Department and USAID. And then we're doing similar legal things for other agencies. My group does a peer support call every week or so. And so this week, because the CDC RIFs like just went through last week, we're opening up our peer support call to include former CDC workers, which is really cool. And they've been just like a really great mentor to us in terms of content and like ways to kind of build out organizational efforts. So I think we've done a good job of supporting one another.
Especially with like the Bethesda Declaration and then the recent letter that we helped push out for in response to the CDC attack. It's been really helpful to have like Anna and a couple other NIH folks really help guide us through that process. Because they had already done it. They had learned a lot of lessons from that. And so I actually think that our kind of letter rollout, one, we did it on our own, like with just us. We didn't use an organization to kind of to support that effort. And because we were able to learn from the NIH folks about what they experienced, we were able, I think, to more smoothly kind of do that. It's just been like a really cool collaborative experience, and not just like with NIH, right? Like we're talking to agencies all across the board. Feds are organizing because we are tired of this. We're tired of being villainized, and we're tired of the public not understanding like how their lives are nice because of the work that we do behind the scenes. And so like we're all trying to support each other, sharing tips, talking about how we are, doing advocacy work, and really like trying to help paint this whole picture of like the value of government, which I think we've lost as a society. JFK, for example, and like this huge call to like serve your country in whatever way that makes sense for you. And like that's what we're all doing. We're serving our country. We may not be in the military, but the work we do is for the public and for our own society. And there's like this like distrust that I think none of us really understand the reason behind.
Yeah, like we care about our jobs, obviously, but I think most people who work in the government are more concerned about the loss of the work that we are doing that benefits people across the country. And yeah, like Abby said, I think a lot of people won't realize that's gone until it's fully gone.
27 United partner with like NIH Vigils, which is just like weekly, a bunch of community members from NIH, former workers and people like that. Like we all show up and talk about, different things that are happening related to NIH, and just kind of like we talked about what happened at CDC with the shooting and then the Save HHS letter. And it's just we're organizing because like we see the impact of what is happening and what people are going to see. Like we talk about, I mean, it's a vigil, right? We meet for a vigil to talk about the like programs and like lives that are lost and like will be lost because of the changes to health research, to prevention work, because we know that it's not just we lost our jobs. I mean, I think that's why it hit so close to home. I lost my job and that's really sad. And like, I don't always know what to do with that. But then like, also it feels like, and hundreds, thousands of people are going to die because of all these changes, because I lost my job, because of this like rippling effect that we're seeing everywhere.
Yeah. The collective assault on public service, just generally.
You penned the Bethesda Declaration and the HHS United letter. So can you tell us about your involvement in those letters, and what are you trying to accomplish with those, and what do they say also?
The Bethesda Declaration, I was one of the co-organizers. There's like so many co-organizers though, right? We like, and I'm a Bethesda Declaration signer. I can say that kind of very confidently that I signed the Bethesda Declaration. And so we outlined like 5 different points that we were concerned about that had been occurring at NIH, and changes that have been occurring at NIH, and just outlined them in this letter. One of the current employees sent it to the NIH director, and I think a part of us wanted to work with the director about some of these concerns, and the part of our goal, to send that was to say, we're on the ground, we're seeing the changes and how they're impacting all our different programs, and like we want to work with you because we are not like, we don't know what to do right now with these changes. They're really negative and things like that. We did not know what the outcome would be, but we also just wanted to showcase that, courage is courageous. And this is the beginning of people speaking out about things that they're really concerned about, people not engaging in illegal orders. We really just care about the health of the American public. And like, we wanted to work with our director, we want to work with RFK Jr., but also we just want to be transparent about the concerns that we have.
HHS United letter, we had been working on something for a few months, but weren't ready to release it. And then the August 8th attack happened on CDC, and it kind of felt like that was the opportunity to say something. We were really disappointed in the lack of response from the administration and from HHS. So a lot of the people who worked at CDC, and then former employees as well, really wanted to come out and say like, hey, this is why this happened, and the lack of response is unacceptable. Abby and I both helped organize that, and really just wanted to help make sure that, especially the people who still work at CDC, that their voices and their concerns were being heard by the administration and also by the American people.
And the CDC letter has 3 very specific asks, and it's targeted at RFK Jr. rather than the CDC director, in part because the CDC director, this shooting happened her first week there. We're actually still trying to kind of see and understand and give our new director a chance to, be a leader for CDC. And so it's directed at RFK Jr., and it asked him to do 3 things. The first one is to stop spreading inaccurate health information, specifically about infectious disease and vaccines, because that is what police believe motivated this person to attack CDC. We also ask him to affirm the integrity of CDC workers. He's called CDC a cesspool of corruption. He is explicitly, made comments about not trusting people at CDC and not trusting the science that comes out of CDC, and really with no evidence, and just as a way to like put a target on people at CDC's back. And so we want him to affirm that we do our work with integrity and with purpose, and that we are not villains or there to screw over the American people or anything like that. And then the third ask is to truly ensure the safety of the people who still work at CDC. And really the only way for him to do that is to stop painting a target on CDC folks and on folks at NIH specifically, because they also work on biomedical research and vaccine technology, which for some reason RFK Jr. is against like the advancement of technology now, I guess. He doesn't want us to do that anymore, which doesn't make any sense to me, but like it has to stop. And if he can't stop, then Congress or the White House needs to get involved because he is the boss of people at HHS. It is his duty to lead us or to lead folks still at HHS and to do it with integrity and have those hard conversations that I think we're asking him to.
The Bethesda Declaration had a lot of concerns about NIH and all the things that have happened to NIH since the change in administration, but then also since, Dr. Bhattacharya, the new NIH director, and kind of saying, are you aware that this is what's going to happen if a blanket 15% indirect cost is applied to all grants in like such an abrupt way, because it was abruptly enacted, right? And then like with the politicization of research, with the challenges to DEIA research, we're seeing a bunch of grants that had been terminated and then reinstated due to court cases and then re-terminated again. Like that is something that we called out directly in the Bethesda Declaration. We were concerned about a lot of different things and brought that to his attention. There were like 60 plus public signers and then a number of anonymous signers. And so we did this in June. Since we released the Bethesda Declaration, other agencies, so there's NASA, the Voyager Declaration, FEMA, the Katrina Declaration, there's the EPA, their dissent letter, NSF also has a dissent letter, and then the Save HHS letter, which came out last week. And so we just really wanted to support CDC because we also are concerned about what happened in the shooting. Not to take the spotlight away from CDC at all, but like people work on vaccine research. Anthony Fauci, Dr. Fauci, the old NIH NIAID, the IC director, he was demonized for a while. I worked at NIAID, right? Like the employees of NIAID, it's not that hard to assume that similar things couldn't happen to people whose work is being equally politicized. And so we really felt horrible for CDC people who are going through this experience, are concerned for our own safety and for the safety of all agencies that are being politicized, because every agency is being talked down upon. That's how we ended up helping with the Save HHS letter. And since we wrote the Bethesda Declaration, a number of declaration signers met with our director on July 21st. 27 United actually co-organized a rally to support those people who got to meet with our director with the NIH.
Jay and Bhattacharya?
Yeah.
So what was that like? I think I saw an Instagram reel of someone talking about it. Do you think you made any progress at that event? What was your main takeaway?
I was not invited, so I can't speak to everything that happened in the meeting. I think that the biggest takeaway that we heard and what I know of is that he said that he would not retaliate against the Bethesda Declaration signers, which I think is a big win for employees who were speaking out. But in terms of changes, a lot of the things that we were concerned about, we're still very concerned about. I think the meeting, it was a time to call those things out further, but like there haven't really been any, at least from my perspective, and I'm not in the agency, right? But like from my perspective, I haven't seen any significant changes to our director's behavior or the way that the agency is behaving since people met with him.
Let's talk about the CDC shooting, because that is something that happened very recently and is honestly very concerning. It was a guy that thought he had been harmed by the COVID vaccine. And I read on the news that he'd actually tried to visit CDC the previous day to gain access to the actual building, and they obviously did not let him in. So you guys don't work on the CDC campus anymore, but what have you heard from people that work there? What would you like to share with us as people that work in this space that have experienced this type of stuff throughout the pandemic?
So Erin actually worked on the COVID response, and I did not. So she can probably speak to kind of the longer term stuff. The recent attack, people are terrified of going back to work, in part because there's been no real strong condemnation of this happening from the White House, from HHS, from frankly any congressional leadership across the board, regardless of party affiliation. There have been very few strongly worded statements, press releases, anything talking about the importance of not attacking federal workers, which is frankly disappointing. JD Vance, the vice president, came to Georgia not even 2 weeks after the shooting and didn't visit the CDC, didn't meet with folks at the CDC, went to a rally to talk about the big, beautiful bill, and then skedaddled out of Atlanta.
Secretary Kennedy came, but he was there when no one else was on campus. He was there for 20 minutes the Monday after, and I think everybody who works on the main CDC campus were either teleworking or just on admin leave that day.
Yeah. So. And he afterwards went to a media outlet, I guess that's located in Atlanta, and did an interview where he continued to disparage CDC experts.
Yeah.
Not even a week after the shooting.
The environment leading up to it. So I worked on the COVID response specifically on social media. So I've seen a lot of the sentiments that the man who attacked CDC expressed for a long time since the vaccines were approved. People have been expressing really negative attitudes towards CDC and FDA, but CDC for recommending these shots, for the vaccine mandates, and just for what they viewed as our role in forcing people to get a vaccine. I think one thing there is CDC cannot force anyone to do anything. We don't have that sort of authority. CDC is able to recommend you should get a vaccine before you do X, and it is up to a business to say, yeah, we are going to require proof of vaccination. That is not something that CDC is allowed to do. But I've seen a lot of the sentiments that this man had for a long time, and people have really just turned on CDC and viewed us as villains for having these vaccine recommendations. And when somebody like Secretary Kennedy is given a leadership position in Health and Human Services, it legitimizes a lot of the things that people have been saying on social media and in actual media. Social media is not a great lens to view things because you have your issues with bots and trolls and things like that. But it is a good lens for the attitudes among some groups out there. So it was not surprising to hear that this man had anti-vaccine views and was taking them out on CDC.
It's just a concerning thing overall. I can't remember if Dr. Bhattacharya, the director of NIH, said anything. I know if he did say something, it took about a week. I don't know if NIH put out a statement about the CDC shooting. Dr. Bhattacharya's actions have really not helped the case of the good things about vaccines. We're seeing canceling of mRNA vaccine and his criticisms of mRNA vaccines, and he's gone on a number of different podcasts and kind of talked about a lot of things. He hasn't said anything very meaningful about the CDC shooting.
I've been listening to you guys, and one thing that really frustrates me as someone that hasn't worked as a public servant in public health in COVID, which, by the way, is such an incredibly thankless job. Thank you for doing that work. One thing that really frustrates me is the fact that it feels like every day when I turn on the news, our leaders, our elected leaders, are just completely ignoring mainstream science. What's your goal with these organizations? And how do you stay motivated when our federal leaders are making such a huge mess of public health?
Having connections with other groups like 27 United and the other federal agencies helps a lot. These are people we never would have met or worked with without this happening. And maybe a mistake that the administration made was pissing off a bunch of dedicated public servants, giving them time to organize, because we are all very motivated and we know how these systems work, and we are committed to helping build back something better.
Yeah. I genuinely believe that on a core values perspective, everybody wants the same thing, regardless of your partisanship or who you vote for. Everyone wants to live in a safe community. Everyone wants to have access to healthy foods and sidewalks, and nobody wants their family members to get sick, and nobody wants their family members to get cancer and not have any treatment. And I think at its core, everybody wants the same thing. And I truly believe that we can get there. We might have different methods. We might have to have discussions about how we get to as perfect as you can be as a society. But I genuinely think in terms of intention, most people in the US want to like live their lives and like not live in a horrible hellscape with no health and no access to prevention. And then also I have a baby. I have a 1-year-old. I I want him to grow up in a nice place. I want him to like have all the opportunities I had and more opportunities. And so like if leaders aren't going to do that in this country, then we as like a collective of like grassroots professionals, public servants have to step up and do the work to get there.
Yeah, I mean, it's really funny, Abby, that you say that, because I say that all the time. I feel like 90% of the population really is all on the same page. It's just about like what we know or understand or believe on like how to get to that place, but everybody just wants to be able to feed their family and like not get sick and just like go to a water park sometimes. I think the arc of justice typically bends towards truth. It just takes time to get there. And so I do think that like some of the strongest supports that we're going to see in terms of like building back or even just filling in the gaps and kind of figuring out what to do in the interim, as like you're saying, yeah, there is this like really intense war on public health and science. What's feels really important to think about when we talk about that is like the people who are doing it. So people who know how to communicate it. A lot of the staff who experienced the reduction in force at NIH were workforce management and then communication staff. These are people who know extremely intimately like science and then also like how to talk about science in a way that's palatable to a bunch of different people, and kind of like leaning on them and thinking like, well, what do you think about for the future of biomedical research? How do you think that we can do this differently, that we can improve moving forward? Something that is really important as we think about kind of moving forward in the immediate and in the long future is like communicating, like Abby and Erin have said, the importance of federal workers, federal researchers, federal prevention workers, federal scientists, and doctors. Like, what do we do and how does it impact everybody and all of America? What are the problems that exist with it? And like, how can we make it better? How do we look at the things that we know are challenges and successes in the past and kind of like building a different future?
Are you well connected with people that work at NIH and CDC right now, or people that have been fired? And like, what are your colleagues doing that have been laid off? Are they finding other jobs in industry? Are they organizing?
A lot of people are starting businesses. One of the sad things in the public health space specifically is a lot of us feel like the field is dying. There aren't a lot of job opportunities out there. A lot of public health is like grunt work. It's not pretty. And the federal government funds a lot of it because it's long-term profitable, but it's not profitable right in the moment. And you invest in prevention because you get long-term health and economic outcomes. And without the government investing in its own people to ensure we're healthy, there is no public health field. And so I think a lot of people are kind of down about trying to find new positions. And a lot of people are spending time volunteering.
In general.
Sorry, go ahead.
It's just a tough job market in general.
Yeah.
Even outside of science and public health.
Yeah. So on our website, we actually have a page, we like just launched it very recently, about 4 former workers who've started businesses. So there's 5 on there right now. There's some career coaching folks, and then people who are doing consulting, and then also people who are just like, I have a jewelry business, right? We're trying to amplify some of those businesses. Something that brings me joy to think about is people getting like doing their passions. So some people are starting businesses. Similarly, although kind of different, NIH funds most of the science that occurs at universities, especially like health research science that occurs at universities. So you're seeing universities like also struggle with layoffs and pharma companies struggling with layoffs. And these 2 fields are really getting hit really hard with misinformation. And we're just kind of seeing their fields just not being very popular. It's hard to then go pivot and find a different job. A lot of people, the job market is just really hard. And I don't know how it is at CDC, but at NIH, the people who've been RIFed, you get people from who are like earlier in their career, but also a lot of people who are close to retirement. And then people who are close to retirement, if they're eligible for retirement but don't take it, they don't qualify for severance. It's also like they're later in their field, so it's challenging for them to find a job because of various factors like age discrimination and things like that. And they're like expensive because they have a lot of experience. And so they're having a hard time finding a job. They can't get severance, and their retirement is still going to be lower just because they were terminated like before however much time they anticipated working at the agency. So people who are like eligible for retirement but are too young to take it are actually like getting hit really, really hard. So something I've noticed is just that it's like hard for a lot of people in a lot of different ways, and people are kind of responding differently. But yeah, a lot of volunteer work too.
Yeah.
So what are all your volunteer jobs?
Yeah.
And you said you work like 16 hours a day on this. That sounds intense.
It's not every day. I think those are just like the really intense days. Some days, because we do get to make all our own hours, some days are really slow, or I can go like do whatever on a Tuesday, but we all work very hard.
Do you feel like you're making progress with this or have met your objectives? Do you see Fired But Fighting and 20H United actually making a meaningful policy change that brings public health back to the forefront of the federal workforce?
Yeah, I think at least from the CDC perspective, we've pushed really, really hard, and some of our wins, we'll see how they turn out. But the Senate Appropriations Committee wants to flat fund CDC for the next fiscal year. They basically rejected the budget that the president put out, which would have cut CDC funding by half or over half. And the Senate said no. And so we'll see like what that actually turns into as far as budgets go, because, you know, they have to reconcile with the House and come to an agreement. But I think in terms of that, we're really pleased to see that, you know, senators understand the value of CDC across political spectrum. And then we are also seeing small wins, like the entire lead prevention group at CDC who do childhood lead prevention was RIFed in the middle of like a huge lead exposure in, where was
Milwaukee.
it? In Milwaukee. And we pushed the media really hard. We pushed Congress really hard, and we worked really hard to educate the public about the importance of this branch specifically, and they've all gotten their jobs back. Small wins like that, they're things that we're genuinely celebrating, because it means that if your kid's elementary school has lead pipes, that they have someone to call at CDC to give them expertise to make sure that your kid doesn't get lead poisoning, which is like basic bar on the floor society, but like a win in our book at this point.
We've also built a lot of good relationships, I feel like, with congressional staffers and provided them with information. And that's on the Republican and Democrat side. We've, provided information to Senator Tim Scott in South Carolina and Senator Susan Collins from Maine. And they've used information that we've given them to help craft questions during hearings with Secretary Kennedy.
Yeah, we get really excited when our questions get asked during hearings.
So for us, we're still figuring out exactly what our advocacy looks like. We're really interested in working on communicating with people who are within universities and really gathering support and trying to figure out, well, how can we connect to this broader health research community that is really suffering and doesn't know what to do, especially when you talk about equity research and research that's really being targeted by these administration changes and challenges, and trying to figure out how we can include them in some of our advocacy and telling their stories and why the research that they're doing is really important. And so we're still figuring out exactly what that looks like. We've had a bunch of wins. Their Bethesda Declaration support rally was really, really great. The Bethesda Declaration wasn't organized by 27 United, but just people from the NIH community. The Bethesda Declaration was useful in certain hearings that happened right around the time of the release of the Bethesda Declaration, which was great. And I think that we're getting more comfortable speaking to staffers and various organizations and building up those relationships and figuring out how we can use the knowledge that we have from being former NIH workers and talking about, this is actually really important, and this research that they're saying needs to be cut because it's DEIA or whatever. No, this is very important. How can we advocate for that and things like this?
So because I've been keeping up with APHA versus NIH, and I was doing some research online, and I was reading about people's terminated grant stories, and there was one person that had a funding mechanism that was a underrepresented people funding mechanism, and that got canceled, even though it was about hearing, and it wasn't like specifically like a quote unquote DEI study. And there was another person that they had their NSF, National Science Foundation thing canceled. And I don't remember if that was like a quote unquote DEI study, but I was trying to learn about APHA versus NIH and what's happening with that. Are you guys involved in that? And are you part of the lawsuit? And what's next for that for you guys?
We're not a part of the lawsuit, but we did work on this memo with the Science and Freedom Alliance that talked about why allowing for the stay that the Supreme Court ultimately, unfortunately, did was really bad. We do have this new storytelling initiative, Biomedical Beats, where people whose grants have been interrupted can tell their stories, and it's also anonymous, so you don't have to give us information specific to your grant, but just kind of, I worked in science, I did this, or I was interested in this, and really, really humanizing people who did this. And you're correct that there were people, mosaic scholars, who it's really heartbreaking, but they had research and they competed against everybody, but just because of the way that their funding mechanism was written, even though their research was not based in anything, DEIA research should be funded. And that's a really ambiguous term and like not super specific when we talk about these grant terminations, right? But mosaic scholars, they could be researching anything and it didn't matter. They were terminated, and it's really sad.
Yeah, because I left my graduate program because I ran out of funding, and that was 2013. And I remember the NIH had put like $200,000 into my career up until that point. And so when I left the field, my research area also went away. And I just heard someone talking about all the different research projects that will no longer exist after this. And that's not even to talk about all the money that was put into training those people in the first place. Like if their R01 grant got taken away, they still went to graduate school and the government paid for them to get that. So it's almost more of a waste of money to end their research than it is to continue that research. And then also the definition of DEIA, I also want to mention, I was reading about it. First generation college students can be DEIA. Rural people, which I think a lot of rural people, maybe they're Trump supporters, but now they're not benefiting from health research, which is really sad. Rural hospitals are closing. That's not directly related to NIH or CDC, but there's a lot to talk about. But more importantly, there's a lot to act about to save public health. So maybe as our closing thoughts here, what would you like to tell the people that are watching this interview today?
What we're trying to do is just make sure that the research that NIH does is able to continue, because you can't have access to medicine that doesn't exist. And so everybody knows somebody that they love who has cancer, who has experienced a chronic disabling condition. Because being sick is like common, even though different diseases and rare diseases can be rare, the research that we do to look for cures and to look to help these people who are sick, I mean, like that's all we want to do. We just want to make people better. And so the work that we're doing is in many ways just trying to make sure that NIH can continue and people can continue to research cures for really devastating conditions.
At least from the like CDC and the prevention perspective, my biggest ask is like recognizing that the people who do this work do it because we have this like deep commitment to community service, and that we're really passionate about what we're doing and about our work. And nobody works in the government for money. We don't make any money off of the research that we do. It just is not true. And I would implore anybody who like thinks otherwise to talk to someone who works in these spaces, because one, you would hate to talk to us because we only talk about public health and we're insufferable and it's annoying. And I'm like confident that you don't want to hear about it. You talk to us and I promise you'll realize like how genuine and boring what we're doing is. And it's exciting for us because we love it. But like generally, we're just people who really nerd out on something and do it for our job. And like that's all this is. If you care about innovation and you like want to be a successful country, you should invest in it. And like this is the opposite of investing in innovation and technology. And you can't be pro technology and pro cutting science. They don't compute.
Yeah. I think the only other thing I would add is like I know people are sick of being told to call their representatives, but like you have to, especially if you live in like area that has Republican or representatives who don't support public health. All my representatives support CDC. They're tired of hearing from me. We need people to get on the phone and tell that their congresspeople and their senators that they need to support a fully funded HHS and that it needs to be free of political interference because science is not a political thing. And I think a lot of us who work in these agencies are tired of our work being politicized like this.
We're not partisan in our work.
Yeah.
And you can see that if you dig into the communities that we serve. We serve every single person in this country. There is not a single person in this country who is not touched by NIH research or CDC prevention.
And I think, disease, especially infectious disease, does not know boundaries. It doesn't care if you live in Virginia or Georgia or California or Kansas. It does not respect those boundaries. And also it's a national security issue, not funding science and public health research because we live in a global society and what happens overseas affects us here as well.
I wish you guys good luck with your efforts, and I hope that you're successful, because when I think about the next 4 years of public health policy, it's not something that makes me feel particularly optimistic. And I think it's probably on the scientists and health professionals, it's on us as voters, as concerned citizens, to make the future the way we envision it and the way that it should be, free of political interference. So thank you for your time today, and we'll link everything in the description box so that people can check y'all out and learn more about this incredibly important thing you're doing. Thank you for your time today.
Thanks.
Thanks for having us.